Welcome back. I have a few announcements. The first is I finally, after all these months, completed my ultrasound course, the one that was supposed to be done with the Eastern Pain Association. Because of COVID, the course was broken up into an online didactic, which I did a month and a half ago, and a in-office practical in which I had 3 physicians come to my office and we went over the views and the blocks with a model. And in this age of social distancing and the big courses and conferences being on hold, we were able to do this in what I felt was a safe manner. So I may be doing more of these, of course, as long as the law allows me to. And if you're interested, reach out to me at drosenblum@rmcpain.com, where we could schedule a group of people, a small group, a safe group, to learn regional anesthesia and ultrasound-guided nerve blocks for applications for acute and chronic pain, especially pain management in the office. Second announcement, ASIPP is having a board review course and interventional pain course the weekend of July 17th through the 19th and July 24th to the 26th. And they've invited me to be a part of that course, and I'm preparing content. If you're interested, I think it's going to be a great course, especially if you're taking the boards or you're just looking to expand your breadth of knowledge. The link is asipp.org. You'll see the link to register. I'm also going to throw a link up on PainExam.com. And I think you'll get a great deal of value from it. I do keep in touch with my alumni and people who've passed the pain boards, and I always try to stay up to date as to what the board is asking without getting myself into any trouble. In addition, this podcast today, or videocast, depending on if you're watching or listening, is with Justin Harvey, who is married to an anesthesiology resident. Justin's a financial planner and has a wealth of knowledge, and he is the missing puzzle to a lot of our financial portfolios because of us physicians are not usually well educated in this realm. So he is interviewing me for his podcast. I figured I'd air it on my show, and he was generous enough to loan me the footage. And I hope you enjoy. I apologize if my audio is not as good as his. I was only with my lapel microphone and didn't have my studio set up at the time. So please check it out. Hope you enjoy. And remember to take advantage of if you're a new incoming fellow or you're going to take the boards in a year, we have the 1-year fellowship plan for PainExam.com. You don't need to be a fellowship to take advantage of the 12 months of access, 40 CME credits, and over 17 hours of lecture, tons of video, and much more. So check out PainExam.com. If you're not a subscriber to the newsletter, please check that out. And of course, the Regenerative Medicine for Spine Disease course. Thank you and enjoy the show.
Hello and welcome to episode 57 of the Anesthesia Success Podcast. I'm very pleased to be joined today by Dr. David Rosenblum. Dave is currently the director of pain medicine at Maimonides Medical Center. He's anesthesia pain boarded, trained at NYU, my neighbor to the north, just up 95. Thank you for being here this morning, Dave.
Thanks a lot. Thanks, Justin.
So I first became exposed to some of the things that you're doing out there on the internet through your podcast, the PainExam podcast. So tell us a little bit about how did you get started in podcasting as a physician?
Well, I was doing board review for quite a while, and being online and in that space, you kind of develop a little bit of a community. People always staying in touch with you. And I started to learn a lot about online marketing and business from another podcast, a Smart Passive Income podcast, which by now I'm sure a lot of you guys have already heard of, Pat Flynn, who does a great job.
Yeah.
And I must have started listening to him about 6-7 years ago, and I learned how to podcast based on his free tutorials. And I figured, let me just dabble with this, see what happens. And I did the PainExam podcast and realized, wow, there's a lot of anesthesiologists out there, and I do have an anesthesia and physiatry board review. So I figured, hey, I'll do the PMR exam and the anesthesia exam podcast and see how that goes. And the one thing I could talk about podcasts is you really need to stay dedicated and religious about producing if you want to maintain on in the Apple and Google Play's radar.
Yeah. And the funny thing is you have to do this thing that's very public, which is do a thing and push it out on the internet, and it has to suck for a long time.
Right.
Before it stops sucking. And you have to get through that. in order to have an okay sounding podcast on the other side.
It's funny you said that because my first few episodes sound completely different than
Oh yeah.
my more recent ones with the professional intro, outro, etc.
Yep. As do mine. I listen back to some of those early interviews and I kind of cringe. But
Yeah.
but I leave them up there because you know what? It keeps you humble. So
Right. True. True.
so thank you for joining us early in the morning. This is actually, so we're setting a record for the Anesthesia Success Podcast right now, a record formerly held by your colleague, Dr. Gary Schwartz, for the earliest in the
My
morning that we're
partner.
starting an episode. So
Yes, we wake up early in New York.
so I appreciate you making time.
Sure.
And I'm looking forward to hearing about some of the, the educational content that you've built, hearing about your clinical practice, as well as some of your perspectives on industry collaboration. Because
Sure.
I know, and we'll start with that last topic first.
Okay.
This is something that in pain management, the majority of the advances in science happen through partnering with Medtronic and Abbott and Boston and many others, which creates, we'll call it moral hazard. Whenever there's economics introduced into medicine, as there necessarily always will be, and whenever the people advancing the science and creating the inventions and doing the tests and the trials and all that, whenever there's economic interest involved, it can create challenges in remaining objective
Sure.
and in disclosing and all that. So I'm curious, how did you first get started in industry collaboration, knowing that in pain management, 70% of spending in R&D comes from companies themselves?
Sure. Well, first of all, without industry, we would probably, it would be a very different landscape of pain management. And I think it's a symbiotic relationship. They need us, we need them. But of course, you need to do everything above board and ethical and not get yourself into trouble. I do, and I have collaborated with industry. And I suppose being a podcaster and someone with an online platform, it's very different than your typical practitioner who may get paid by a company and then can be accused of using that company solely over the competitors. So having some other platform in which you're providing a service either to that company or to the doctors by education is different. For instance, in the past, I've worked with Boston Scientific, and what they actually wanted from my doctors was a survey answer. They had 5 questions that I would push out to my docs. They also probably wanted the contact info of these doctors, and the doctors would answer them in exchange for a cheat sheet or some other type of service I could provide for them. And I think the way you stay out of trouble is you basically, it has no connection to the amount of spinal cord stimulators I do with that company over another.
Yeah.
You have to make it clear with that, and you can always show the agreement that you get into to a healthcare attorney. And being involved with the New York State Pain Society, they have a great attorney who's looked at some agreements that I've done with industry in the past and has given guidance and try to keep you out of trouble.
Yeah. What would you say characterizes a really rewarding and productive relationship with one of those companies?
First of all, they have to have a product you believe in. I've worked with pharmacies also. So pharmacy is a pharmacy. I mean, obviously you want them to give good service if you want to be associated with them. But in terms of biotech industry, you don't want to be associated with an inferior product, even if they're paying you a lot. And I've had the luck to be involved with great companies, and the item kind of sells itself if it's a good product. You're just another piece of the puzzle saying, listen, I've used this and I'm happy with it, or they're sponsoring this episode and it's worth checking out, or at least talking to their rep to see what the deal is.
How has your access to these types of opportunities evolved over time? Talk about maybe coming out of fellowship. What was the landscape like? And as time's progressed and your profile as a physician has been raised and, you have a busy, productive practice there in New York, how has that changed over time for you?
Well, over time, I think I've become a little bit smarter with respect to the whole online industry, community forming, tending to my newsletter, and those email lists are very valuable. People have asked to buy my email list. I can't sell it. I don't have that sort of agreement with my users, and I wouldn't do that. But in terms of, marketing on behalf, first of all, you have to disclose that you're an affiliate of this company and that you have some sort of agreement with them, or if you're going to profit off of any sale made. But it's not a majority of my income. It's not even a big part of my business. The biggest part of my online business is actually board review and providing a service to doctors. And when I first got into the space, or at least I first realized the advantage to partnering with academic societies. I realized a lot of these societies are non-for-profit. And the best and smartest thing I could do is to utilize my platform to help these societies for free. So by partnering with them, I help them get exposure to my audience, get people to come to their meetings. And in exchange, they help me with marketing in exchange. Maybe I get a table at their conference, or they, like what I'm doing with ASIPP right now, we co-market and collaborate on academic ventures.
Awesome. That's a great idea. I got to try that with my podcast.
Yeah, you should.
Awesome. So talk a little bit about your current clinical practice.
Okay. So we have basically we're a 90% anesthesiology practice. We are the anesthesia group that's contracted to run the operating room at Maimonides Medical Center, where we cover different ambulatory centers and private offices in addition. We have probably about 30 or so partners, another 30 or so employees, and a lot of residents. And the pain practice is right now, I think we're about 6 docs. And we cover the various boroughs in New York, and including some of the suburbs such as Westchester and Long Island. Okay. And we're very interventional. We try to minimize opiates. And each pain doctor, as with most practices, may or may not focus on different things. Some docs do more neuromodulation, some docs stick more to the traditional bread and butter.
Yeah. As of the time of this recording, which is the end of June, it'll be a few weeks until this is released. I'm curious, how has your experience been during coronavirus? How have you guys been able to adapt? And how are things looking there? And I know New York has been a hotspot, obviously.
Yeah. So it's been crazy. We've done obviously a lot of telemedicine. In terms of the anesthesia side, we're doing sedation rounds up until recently. Thank God we don't really have that anymore, but that may happen again if there's a second wave, which I think there will be. I think it's a matter of time, but I'd like to think we're more prepared.
Yeah. Yeah. How had the implementation of telemedicine, how did that go? Is that something that you guys had done a lot of before?
It's funny you said that. About a year ago, we realized we could do it with our EMR, and we did some experiments. We tested it out on some patients. The big question was, were we going to be reimbursed properly? And we didn't want to take those chances, and you do it, and then you realize you don't get paid. So once this all happened, and then we found out about the rules of telehealth being lightened up, we didn't have a choice.
Yeah. So I'm curious with your practice, there's a lot of legislation happening right now about reimbursement for different types of procedures because of coronavirus, the waivers for paying for telehealth the same way as if somebody came into your office. Who do you have in your practice that sort of keeps a finger on the pulse of like those types of things? It's a pretty complex legal environment. I'm wondering, it changes almost every day, it seems like.
So we have a billing company, a huge billing company, which gives us guidance. We have an administrator who deals with them, and if we have questions, we'll ask them directly. Yeah. But the docs also, the doctors in the group, we have a little group chat that we share ideas with and latest news, and try to keep each other updated. Yeah,
I know Dr. Schwartz and I first met or reconnected most recently at the practice management meeting at ASRA, and that's an area of acute interest for both of us. So
sure.
Talk a little bit about, as you're thinking about the craziness of the last couple of months, are there any stories that stand out, whether it's a patient encounter or collaborating with one of your colleagues where it's like just something unusual that's a product of coronavirus that you might not experience again?
Yeah, probably there's a lot of stories. I mentioned one of these on my podcast where my first day in the hospital during, my whole thing was, I said to my family, I said, look, I said, because I'm a pain doctor, mainly spending time in my office. I would normally do Monday pain rounds, but when the coronavirus started and they stopped elective surgeries, there was really not, we have mainly a acute pain service that's really regional based, not so much opiate management. And so when there was no elective orthopedic surgeries or other types of surgeries, there was a very few patients on the pain list. And so the rounds were very short or non-existent even. And I said to my family, I said, look, I said, they didn't want me to go to the hospital, of course. And I said, I'm like a fireman. It's not like I can't do it.
Right.
If I don't do it, and given, yes, we have a very large group of anesthesiologists, but if I don't do it, who's going to do it?
Yeah.
So I had no problem going into the hospital to do the COVID rounds, which was on intubated patients. And it was very eye-opening because of you had nurses, and I mentioned on my podcast my cousin who's a floor nurse at Maimonides, and I walked up to her, said hi. She didn't recognize me, and the scary thing is she's going to every day. It's either 6 to 9 patients that she's caring for. She's a regular floor nurse. I mean, it's a cardiac floor, but she doesn't do ICU. But she had all these intubated patients that she's managing herself on pressors, on sedatives, and she was overwhelmed. I mean, she looked like she had it together at work, but afterwards we texted, and it's just sad that these nurses, they're the ones who are really in the rooms all day long, watching them die. There's no family members at the bedside to advocate for the patients. And it's a very scary situation when you have overwhelmed people who are trying their best to take care of these very sick patients. And their support, but it's not as, there's not enough eyes on the patients. His family members can't be there. But then again, I understand that because that's more dangerous.
Yeah.
So it's just a tough situation that society has to deal with.
Yeah. Are there any ways that you have changed or adapted or are preparing yourself for, if and when that kind of happens again? Things that you guys have learned?
On a personal note, I'm taking lots of vitamins. I never was a vitamin person. I was always, I'll eat healthy and get my vitamins from the vegetables and whatnot. But
yeah, I got a big thing of those vitamin C gummies sitting on our counter downstairs.
Right, the vitamin C. So we went crazy. I mean, we have a friend who's a nutritionist. Her husband's an anesthesiologist. He was actually one of my former residents, and she's that. She's one of those know-it-all people, but she knows a lot. I'm not saying she doesn't, but she always has some nutritional advice on every little thing. And us doctors, it's like the gastroenterologist when it comes to nutrition, or the pain doctors when it comes to physical therapy. We're specialists, but we still might not be the best people to talk to about these things.
Yeah.
Because of our nutrition training is way more limited. Maybe a month or two in med school, and that's it. So, and a lot's changed in the last 15, 20 years. So I had selenium, zinc, vitamin D. Vitamin D is a big thing, which has been linked to improved outcomes or poorer outcomes if you have low vitamin D levels with COVID. Have all these other things in case you get sick, such as this thing called Russian Immune, which is, I think, like it's one of those probiotics. But either way, we personally did a lot of modifications. I know a lot of friends who stopped smoking finally. And in terms of the practice, well, now that we're ramping back up, we took chairs out of the waiting room, so we can only have a limited number of people there. Yeah. We staggered the appointments. We're still doing telehealth, but with our patients who are on opiates, we're telling them, you need to come in for a drug screen. Can't keep doing video refills and not paying attention to these things. So.
Right. Yeah, makes sense. Tell me a little bit about, you mentioned right before we jumped on the call, just about how you define success for yourself as a physician, and the way that you pursue a number of things as a as a physician and as somebody who's an educator and is contributing to the pain community and the body of knowledge for especially young clinicians. Tell me about how you think about that. How did that sort of come on your radar as something that you wanted to pursue? And what does it currently look like for you?
Sure. Well, to go a little bit opposite of what I told you before, I remember being at NYU and I had an attending there who was back then making like, I don't know, a base of, or a salary probably in the 200s. And he was telling me, he's like, yeah, I don't need to do private practice. He's like, how much money do I really need? I'm like, it's a nice attitude. He's not greedy or at least obsessed with money. But then when you think about living in Manhattan on 200 grand per year, if you live in Manhattan, it's not a lot of money. It sounds like a lot of money. It's more than 99% of the country makes, but in New York City with a family,
especially when only 100 of it makes it to your checking account.
That's right. It's just not a lot of money. I mean, he probably made more than 200, but still, with overtime and whatnot. But the point is, I look at success as not a financial number. I need to be able to afford to live in a nice house and afford to be in a safe, nice neighborhood and educate my children in the way I see fit, as well as afford retirement and, things to do in leisure. Success is not a numbers game. I have a lot of friends who left New York, probably make twice as much as I do. Are they any happier than me? I don't think so. I get a lot of satisfaction from my job. I always said to myself, if I'm going to make a lot of money, which, everybody wants to make a lot of money, but my goal wasn't to do it by doing more procedures or seeing more patients or letting it be at the expense of my patients or my integrity or morals with respect to medicine and treating patients. I wanted to be the best doctor I can be, but I also have outside interests. As a kid, I was always interested in creating music and being a musician, which of course never happened. But I was also very creative. So I remember being an anesthesia resident in Bellevue back in the day before iPhones, we used to have Palm Pilots, which if you don't know are these little devices.
I used to have a Palm Pilot.
Okay, so
nerd alert.
Yeah, nerd alert, exactly. I remember having a beeper, the code phone, a Palm Pilot. I mean, ridiculous. But this is back in the day, and we're talking about 1998 to 2002. I was in medical school. There were no smartphones. And I remember starting my anesthesia residency. I was in my first year and it was still before the iPhone, probably 2003, 2004. And I was always thinking, well, what could I do to innovate, to create some sort of, I don't know, device, product, service. And I'd sit there in the anesthesia call room and I'd list ideas on my Palm Pilot. And by the time I got to my pain fellowship, I had a very long list and I never had time to do any of these things. And I was in the pain fellowship. I'm like, well, I need to study for this pain exam, but wait, there's nothing to study from. So that's where the whole PainExam thing came from. And within a month or two, not only was it profitable, it made back all the money I invested in creating the whole thing, but it was in the top of Google organically, which, as you know now, is almost impossible to get so high organically with a business or some sort of board review site or anything like that. And it happened because there was such a high need and there was nothing in the space. And if I created PainExam now, it probably wouldn't have shot to the top so quickly.
Right.
But getting back to your question with success, having this whole podcast and be like you have, and building a community online, or at least having people connecting online and getting value for your service, that to me is success. I've already achieved that goal. I'm very happy with what I've built, and I look forward to growing it even more and partnering with people like you, people like ASIPP, societies, NANS, EPA, et cetera, who we basically build off of each other and help leverage each other.
Yeah. So for any listeners out there, if you go to anesthesiasuccess.com/57, we're going to put links in the show notes to the pain exam and all the content that Dr. Rosenblum's been working on. A lot of great resources there that I definitely want to, if you didn't already find it on Google, you can go to anesthesiasuccess.com/57 and see what we're talking about there.
Which is a great show, by the way. I'm sorry to interrupt, but I was listening to the RVU episode this morning on my way to work, and I'm not based on RVU. My practice is we don't use RVUs, and so I actually know very little about it. It was pretty eye-opening, and it's just good to know in case I ever need to worry about it, or we change our model.
Yeah, I'm hoping to do another sister episode on doing percent of production, and so there's obviously one of the reasons I have a job is because the way physicians get paid is so darn complicated that
and we're not educated.
Yeah.
In this, it's scary.
And there's frankly a lot of incentive to keep our hardworking physicians in the dark about the economics of these things.
Yes.
And that's one of the missions of this show is to, close that knowledge gap.
Yeah.
And obviously we're coming at it from different angles, but I very much see us as allies in that journey, which is a lot of fun.
Sure.
Okay. I think that's I want to respect your time here, and I appreciate you being with us this morning, Dr. Rosenblum. I want to close with a story of you're somebody who has a pretty prominent presence in the pain community. You've given a lot. You're very well respected and reputed, and someone to whom a lot of people look for getting oriented. And I'm curious, with all the things that you've accomplished clinically, through creating education content in your businesses and things like that, what's something that you can look at and you feel like an accomplishment you're proud of, or that really is something that you feel like has actualized your professional efforts?
Aside from my patients and, of course, helping my patients and seeing when people can get their lives back together, or people tell me even, you saved my life, which, believe it or not, has happened, not just because I got them out of bed for pain problems, but sometimes you work them up and you find tumors that they get cured from. But in terms of my pain exam and side projects, I think when I get to meet the listeners and people who've used my review to pass the exam, when I meet you guys at conferences or you email me, to be honest, I sometimes get more excited over that than when I make a sale. It's just a really nice feeling to know that I've helped somebody along their journey to become a board certified physician or anesthesiologist or any other clinician in their practice.
Awesome. Well, thank you for sharing that story. Thank you for joining us today on the Anesthesia Success Podcast.
Thank you, Justin.
All right. That's a wrap.
Great. Take care.